Hi, this is Lauren Lieback.
And Jasmine Plaza.
We are pelvic floor physical therapists at Ascension Outpatient Rehabilitation. The purpose of this presentation is to focus on how cancer treatments may impact your sexual health.
Our objectives are to ensure you understand how cancer treatments can affect your body and its implication on sexual health. Understand the importance of the pelvic floor muscles in relation to sexual health, identify interventions for pelvic floor therapy, and understand how to get a referral for pelvic floor evaluation and treatment, as well as what to expect during your visits.
As you undergo cancer treatments, such as chemotherapy, radiation treatment, hormone therapy, and surgery, you may have symptoms that can affect your daily life. Pelvic floor therapy can provide a treatment plan to address these symptoms.
As you continue through your course of cancer treatment and recovery, it is important to understand signs and symptoms associated with pelvic floor dysfunction that may impact your sexual health. Possible side effects that may occur include vaginal dryness, vaginal tightness, constipation, urine leakage, stool leakage, pelvic pain, and muscle weakness. It may also include body image concerns, anxiety, fear, and depression associated with participating in sexual activity.
The pelvic floor is a group of muscles that form a bowl at the bottom of the pelvis. This group of muscles works as a system with your abdominal muscles, your back muscles, hip muscles, and diaphragm to prevent any pelvic floor dysfunction. Improving the mobility, coordination, and strength of the pelvic floor muscles can improve sexual function.
Next, we will further discuss how these treatments may impact your pelvic floor and sexual health. Common pelvic floor impairments that may impact your sexual health include vaginal dryness and tissue fibrosis, muscle weakness and incontinence, constipation, dyspareunia or painful intercourse, depression, and reduced desire.
Vaginal dryness often may occur with changes in levels of hormones in the body and early induced menopause. As a result, patients may notice pain with sexual intercourse. Tissue fibrosis is a process that may occur after undergoing radiation. This causes changes in the tissue elasticity, resulting in symptoms of tissue tightness and/or pelvic pain with sexual intercourse. Pelvic floor weakness can cause urine, fecal, and anal incontinence. This muscle weakness is a result of menopause and aging. Research indicates that muscle mass decreases with age, which results in weakness.
Pelvic pain is a frequent complication of cancer and radiation therapy. It is associated with urgency in defecation and loose or watery stools. Constipation is one of the symptoms affecting patients with cancer. It is a result of chemotherapy, reduced water intake, and decreased physical activity.
Other common implications of cancer-related treatments are changes in sexual desire and depression due to changes with perception of body image. If you're experiencing any symptoms of depression, please reach out to your medical provider for further resources. Pelvic physical therapy interventions that are evidence-based can help treat the previously mentioned symptoms.
If you are experiencing any pelvic floor impairments, including pain, weakness, incontinence, or tightness, please speak with your provider about getting a possible referral to pelvic floor physical therapy. During the initial evaluation, the physical therapist will complete an examination in a private room, which will include a review of your medical history, strength, range of motion, mobility, and internal pelvic floor muscle assessment. And based on your clinical presentation, the therapist will recommend a specific frequency of treatments to assist you in reaching your rehabilitation goals. Typical treatment frequency is about 1 to 2 times per week for 6 to 8 weeks.
Evidence-based pelvic floor physical therapy interventions can help treat the previously mentioned symptoms. These treatment strategies may include vaginal lubrication or moisturizers, pain management education, relaxation strategies, stretching, vaginal trainers or dilators, pelvic wand, biofeedback, diet modifications, abdominal massage, toileting strategies, internal and or external self-massage techniques, and core strengthening.
Evidence has shown that pelvic floor muscle training is 80 to 90% effective in treating incontinence. Pelvic floor therapy can reduce constipation symptoms by 63 to 74%. Research has shown that pelvic floor therapy can improve the overall quality of life with patients having pelvic pain and sexual dysfunction.
So it is time to take back your control of your pelvic health. If you're experiencing any pelvic health symptoms, please reach out to your medical provider to get a referral for pelvic floor physical therapy. Then contact our team at Ascension, Alexian Brothers Outpatient Rehabilitation at the phone number 847-981-5556, option 2, or fax 847-981-2034. You can ask to speak to one of our pelvic floor therapists. Here is a list of our pelvic floor therapists and their clinic location. As a pelvic floor therapist, again, we are here to help you with your healing journey and help you on your way to recovery.